I'm Dr. Alex Jacobson with the UT Health East Texas Orthopedics and Sports Medicine Institute, and these are the top 5 things about PRP that you need to know. Yeah, great question. So PRP is platelet-rich plasma. It's a really exciting newer area within orthobiologics, regenerative medicine, sports medicine. It's where we take the body's own platelets, a component of the blood, and inject it back into an area of chronic issues, chronic pain, be it a joint, a tendon within a muscle body. PRP has a massive and ever-growing list of indications and has really great high-level evidence for a number of things, between different arthritis and joint problems from knee, hip, ankle, elbow, wrist, even thumb arthritis, to really great evidence about different tendon or muscle conditions, so tennis elbow, medial epicondyle, rotator cuff disease, patellar tendon, gluteal pain. You'll come into the office, the nurse will initially draw a small amount of your own blood. We put it in a centrifuge where it's spun down to separate the different layers of the blood. From that, we take that platelet component, which ends up being concentrated somewhere 2 to even 10 times normal concentration, and then typically under ultrasound guidance, we'll inject that back into the desired area, whether that's a joint, ligament, tendon. As far as the frequency goes, oftentimes 1 or 2 treatments is most common. In some cases there may be a third one indicated, but that all depends on how we customize the treatment plan. Oftentimes for 2 weeks before and 2 weeks after the treatment, we have people hold off from taking anti-inflammatory medication to try to maximize as much of that recovery as we can. Oftentimes we do have a period of reduced or modified activity after the procedure, and again, that's to try to help gain as much of that recovery and regenerative capacity as we can after the procedure. So the cost of the procedure, unfortunately there's not an insurance company that's covering a lot of the sports medicine indications that we use this for right now, so this is a cash pay service. That being said, if you look at the cost benefit of various other modalities, especially things like steroids having to be repeated every so often, and knowing that those may have actually detrimental effects to joint, tendon, soft tissue. Again, part of this depends on how we customize the treatment plan for each individual patient and within the context of their disease, so that's something we can kind of talk through in clinic if this is something that's appropriate.